The Sioux Falls VA hospital was without a director for all of 2019.
But the new year brought a new director. Lisa Simino started at the VA on Monday. What brought her to Sioux Falls, and a look at some of her biggest goals for the VA's healthcare system in tonight's Eye on Killaland.
I got here on Saturday morning. It's the first time I've stepped foot in South Dakota.
Staff members at the Sioux Falls VA hospital are already working to help their new director feel at home in South Dakota.
Start your vehicle 15 to 20 minutes before you leave.
At least 15 to 20 minutes.
Really?
While the weather may be much cooler than her last home in San Antonio, Texas, Lisa Simino grew up in Maine and is excited to come to a city with all four seasons again.
This is the only one that I really wanted to come to. Sioux Falls has a fantastic reputation. It's one of the 20 most livable cities. I did a lot of research. It's a very walkable city. I love to walk.
It's a good thing.
I love the oncology in the front entrance.
In her first few days, she's already done a lot of walking around the massive Sioux Falls facility.
They gave me a big tour yesterday, almost 10,000 steps, and it's beautiful. I've got to admire the interior designer. She's got a real eye for making this homey and welcoming versus clinical and sterile, which is what the VA is known for.
High praise coming from someone who's worked in many hospitals around the country.
This is my 30th year in the VA.
From Philadelphia to Miami, San Antonio, and her home hospital in Togus, Maine, she has a wealth of experience working with VA medical centers.
I love the VA. It's all I wanted to do after college. I grew up in the VA with my father and my uncles. My uncles were World War II veterans from the Pacific Theater, and my father was a Korean-era veteran.
That family connection giving her first-hand experience of what's important to many VA families.
I understand the challenges that the families are facing because it means the daughter, the grandchild, taking time off to get their parent to their treatment.
She says making care easily accessible to veterans all over the region is one of her biggest goals.
I grew up with that in Maine because Togus, while it's a good medical center, for the big procedures you need to get your family down to Boston. So I understand the challenges of having to leave your community to get the care that you need. It's important to get the community clinics out there, to get that first contact, to make it convenient.
Now she's overseeing the entire Sioux Falls VA healthcare system.
So our Sioux Falls site here, as well as we have outpatient clinics in Watertown, Aberdeen, Sioux City, Spirit Lake, and Wagner.
Serving more than 420,000 veterans and the large regional staff.
We have right around to 1,100 to 1,200 employees.
VA Human Resource Specialist and veteran Brent Wilder is excited to have a new director focused on care.
It's just great to see someone who's going to be there every day leading the charge for us, making sure that patient care is always first.
The most important thing is to meet their needs.
Simino says the challenge is meeting the ever-changing needs of the growing veteran population.
We're getting a younger population in. They have very different needs from the geriatric population, so it's dealing with that dichotomy. They've got different physical challenges. Their campaigns resulted in different illnesses.
To meet those needs, Simino says recruitment is essential at both the hospital and the regional clinics.
It's very important that we can attract doctors that can provide the services that each generation needs. And to get those services timely, close to where the veterans are so that they're not losing time from work, especially the young veterans.
She's excited to look out her new office and see the work the Sioux Falls VA is already doing to meet that goal.
They've got a beautiful new oncology clinic. They're building a new mental health building. There's a lot of expansion and growth here. I'm very excited to be joining this.
Well, the Sioux Falls mental health care facility is estimated to be completed in May of 2021.
The